Good evening, all of you. It's already 7 o'clock, but we need to wait for some more time, guys. Let other people join us. We'll wait for. Good evening, guys. Good evening. We'll wait for 2 3 minutes more because we have 100 plus registration in this course, and still only 40 I can see. Good evening, guys. Good evening. So happy to see you all. Just 2 more minutes at 7:02 or 7:03, probably we'll start the session, okay? Just wait for 2 3 minutes. Okay, good evening, those who joined right now. I think we have now sufficient strength to go ahead. Guys, very first lecture, so I have to give some instructions to you. See, your attendance is extremely important in order to get the certificates. Okay, just a minute, I will start the recording for you so that later also you can see it. Okay, so this is since this is the online sessions, okay, throughout the 7 modules, your attendance will be extremely important in order to get the certificates. You need to understand the sincerity of this because we don't want any type of conflict later. Okay, this all of the sessions will be recorded, so our team will monitor who joined and who did not join, and you need to join it, on daily basis. Okay, daily you need to maintain your attendance. Just a minute, just give me a minute. Okay. Good evening, guys. Good evening. Those who are personally wishing me. Okay, so one more thing. See, on we will be having a 1 and 1.5 hour of session daily. Okay, so almost 1.5 hour session daily will be there, and you will be giving the all the access if you want to speak, if you want to raise your query. You can do it at the end of the session because we have more than 100 participants in this those calculation, the whole course. So for that reason, to avoid any type of disturbances in between, uh, ongoing session, I won't allow you to speak or turn on your microphone. But this is very sure that at the end of the session, I will give you access to unmute yourself. And if you want to write your query in the chat box, that is also a good idea. If you don't want to speak, you can simply put your whole query into the message or a chat box, and we will try to solve it at the end of the session. Got it? So every module will be having a lots of things, okay? And as this is the dose calculation course, you need to have a pen and paper with you. That is also a part of the instructions, okay? Please keep your notebooks and pen ready with you so that you can apply some formulas, because we will be having some hands-on techniques also. We will calculate some doses after learning theoretically the whole concepts, okay? We will apply it practically, but you can take it from this session, I can say, if you want to take it, as in full potential, you need to calculate it by yourself. Please have note and pen with you, correct? And also, by the end of 7 modules of this whole course, you will be having a MCQ exams. Okay, MCQ exam also. One exam will be there. So for that reason too, you need to have the notes with you. Okay, this session will be recorded. After each of the completed session, you will be getting the notification in the WhatsApp group. The link will be shared, and by tapping on the link, you can watch these recorded sessions later as well. Okay, so no need to worry about it. And understand, in case of an emergency, you are not able to attend the session, you need to inform me priorly or in a group. Okay, your message should be there with proofs. What is the reason behind it? And then our team will, consider you for getting, for the certification or, eligibility. So these are some instructions you need to follow throughout. I hope it is clear to you. Okay, and one more thing I want to say, this is online session, so in between, if you find certain glitches, or if I'm not audible enough or the screen is not visible enough, feel free to drop the message in this class as well. Or else you can directly put the message in the WhatsApp groups as well, because the group is for us only. So this is the online session. I maybe I am involved in the PPT presentation, and if you found anything which is not audible or visible, please feel free to drop the message in the WhatsApp, so that I can get the notification and we can solve this issue. So these are some instructions from my side, and this first session will be on the foundation. So this will be going to be very very basic. We will set the foundation today, and from tomorrow onwards we will be diving deep into each of the category, whatever you have in the brochure. I hope you have seen the brochure. So we have extensively categorized your modules, and we have lots of things to discuss further in upcoming week. My learning objective is very clear, that you should feel confident. Okay, so before I can proceed with the session, I will brief you about what is coming and what is the whole course perspective, and then I will share the screen, and then we will go for the foundation session. Correct? So you know what? Before anyone panics hearing the word calculation, okay, let me tell you something very very honestly, guys. This course is not about the complex maths. Okay, we are not going to deal with the complex mathematical things. It's about thinking clearly with the utmost clarity, I can say. Right? Because most of the students feel, scared of the dose calculation, because somewhere someone told them that this is, tough. This is very tricky. If you are going to do one mistake, you will fail completely. Right? But the truth is little different. The truth is those calculation is actually very very logical, very very structured, I can say, and you can learn it. Okay, you can learn it initially, and it is easy afterwards. If once your it is fit into your memory, it is very easy to calculate later. So think of this whole course like I can give you an example, learning to drive. Just consider the course as you are learning to how to drive a car. So at first, of course, it is very difficult to remember what is clutch, what is gear, what is brake, right? Everything feels confusing. But once the logic settles in, your hands and minds, whether hands and mind and legs start working together. Correct. So this is almost same with the dose calculation, guys. So by end of this course, I don't want you to just solve the problems which are existed while handling prescriptions, but I want you to look at the prescription and feel confident. Yes, I can resolve this query by dose optimization. I can resolve some real time problem, right? If the patient is suffering from renal failure and having some drugs and it is indicated, right? How can we calculate dose appropriately for the particular patient? That is what I want, and that is skill. Okay, it is not theory. If I can say that if the patient is suffering from any kind of hepatic or renal kind of problem, these are the these are the formulas. Go and calculate. This is theory. But when I say you need to calculate it for the particular patient, aiming for precision therapy, aiming for personalized therapy, that is skill. And we are going to deep dive into this skill type of scenarios, not about theories. So I will put some formulas in front of you, but I will be very honest that when you can apply this, because in our reference books and all, in very much large amount of publication about this those calculation articles are also there on the Google. So why I am here? So I am here to tell you how to deal this, how to deal with this formula very, very critically and clinically. And in which scenario exactly you need to calculate, and in which scenario it doesn't fit at all. Okay, so these are the things I will direct you how to think like an like an clinical pharmacist or just a healthcare professional, I can say, right? Because that mindset is different, that skill is different. So this is about the course. We are not going to focus on the theory. I will not going to ask you at the end that what is the formula for renal impairment case, what is the formula for HIPAA. Of course, it is mandatory to remember, but apart from that, even apart from it, the important thing is to when to apply, in which scenario to apply, how to apply, in which scenario to avoid. These are basic things, right? And that is out of your textbook, out of your comfort zone. That's where the skill is required, and that's where the logic is required. And every patient is different, guys, right? Every patient coming in front of us is different. The scenario is different. The physiology is different. So we need to think in a very, different and various perspectives to calculate the optimal dose. Okay, so I cannot promise you that by the end of this whole 7 modules you will be expert in doing a dose calculation, because this is something where the practice is playing a major role. So when you are starting a practice of calculating every prescription you are handling, that's where your expertise will be, expand further. So by the end of this whole course, of course, I can promise that you will be able to feel more confident while handling the dose optimization cases, while seeing the prescription. Okay, that's what I can say. Otherwise, I will give you the disclaimer in the very first class. Okay, I won't set any type of fake, fake expectations here. You need to practice it with the pen and paper while looking at the prescription every time, whatever you are learning today, because that is what exactly the objective is. Correct. So practice is must. Right. So only I will say you will raise answer, you will raise questions and I will answer. That is not the thing. Okay. It is going to be only 50%, I can say. 50% which is remaining, which is in your hand. Correct. So next time, whenever you see the prescription, grab your note and pen. Whatever you are learning in this modules, try to correlate, connect the dots. That's where exact the practice begins. Okay, so every number, what is the importance of this whole module and whole course, why I have come up with this course. So every number we are calculating as a healthcare professionals eventually reaches to the real patient, guys, right? And that's why precision is very much having importance. Precision matters actually. I'm saying this not to scare you, but I hope this sentence empowers you, right? It gives you motivation and curiosity to learn this whole precision dose calculation. Your objective should be different. Your objective should be different. It is not about certificate. It is not about, yes, I'm going to deal with it by tomorrow morning. No, it is about making a habit. Okay. So, and what is the good part about doing a dose calculation is, what, when you know how to calculate correctly, you become one of the most trusted people in the healthcare team. Okay, so that is your motivation to start the session. And this is a safe place to learn, guys. Okay, whatever we are providing and you are learning, this is very safe place to learn. You can ask your endless doubts here, silliest doubts here. Okay, you can make mistakes here whenever we are doing a hands-on practice by tomorrow. This is the foundation. So today we will not going to have some calculation. By tomorrow we will be diving deep into it. So you can make mistakes. You are allowed to, because this is where exactly mistakes should happen. Okay. So my job here is not to judge you. Please remember, but I am here to guide you step by step until the thing starts making sense to you. So relax, okay, and take a deep breath if you can, and trust the process, because those calculation, that sounds very heavy to us. And if you stay with me throughout the 7 days, I promise that those calculation will go from fear to confidence, right? So this is what about the, I can say, a small orientation type of thing to make you aware about what we are going to learn throughout the course. I hope it is clear to you. May I get some reactions if it is making sense to you? Yes? Okay. So happy. So, all right, let's begin our journey into this precision dose calculation with utmost clarity and the patient safety. It is going to be fun, of course. Okay, so you don't have, guys, right now the access to unmute yourself, but you have access to put the message in the chat box, correct? So you can put your all of the queries if you have in between. You can feel free to drop the message in the chat box. We will try to solve at the end. And I will also provide you access to unmute yourself at the end of the session, just to avoid disturbances in between. Okay. So in between also I can give you access and some time if you have some questions. And one more time, I want you to I want just give you sorry, I just want you to remind that feel free to drop message in the WhatsApp group as well if you feel any type of glitch in between, because that is extremely important, right? Okay. So let's begin. I'm just sharing the screen with you. Just a minute. Give me a minute, just a second. Yes. Is it visible to you? I hope the screen is visible to you. Okay. Thank you so much. Give me a minute, guys. Just a minute. Okay, so I hope this title is making sense to you right now. This is only the base, okay? This is only the base foundation of clinical dose calculations. So we will see some how to do some, how to apply some formulas and how to interpret the dose, how to interpret, how to read the prescription correctly to ensure the patient safety in the pharmacy practice. And this session further, establish the critical mathematical foundations which are required to error free. So this session will be very important to you to set the base. Okay, this session will tell you that what to avoid, how to read the prescription, what are the commonest errors, and why exactly the dose calculation matters to us when it comes to the patient safety, when it comes to the pharmacy practice, when it comes to the patient centered approach. Okay, we as a whole healthcare team are evolving. around the one basic thing, which is a patient care, guys. Okay, we are here to save people. So basically, our the main objective is the patient safety, and for that reason, dose calculation is the big, I can say, underrated, right? Because no one is practicing how to do a dose calculation apart from what physician and clinicians are doing. But this is our prime objective, prime roles and responsibilities. We can consider one of the prime roles and responsibility as a healthcare professionals, as a pharmacist. We need to have this knowledge when we are comparing the pay scales and role responsibilities of the clinical pharmacist or basic pharmacist, I can say, in India versus abroad. Just have an image of this thing very vividly in your mind. When we are comparing the pay scale, whenever we are comparing the status, the roles and responsibility of pharmacist or a clinical pharmacist is having in India or abroad, you can have immense things inside this whole scenario, right? Those pharmacists are doing this practice in real time, right? They have the knowledge related to dose calculation in very detail. They have a very patient centered approach. They are doing TDM, therapeutic drug monitoring there. They are doing medication review things. They are doing HEOR, and lots of things are they are practicing. So these skills are, I felt, somewhere is missing in us, right? So we need to build a strong base for that today, and then from tomorrow we will dive deep into it. See, this is the roadmap for the clinical calculation mastery. So see, since this is our very first class, let me show you that where we are going. The roadmap is to show you where we are going. So, you don't feel lost in between. So, we will see this five things. You can see a comprehensive overview of five very basic core modules we will cover in today's 1 hour or 1.5 hour foundational training session. So, very first, we will see human cost of errors. Okay, so we first understand why this error happens and why calculation matters. I always start my sessions with why, guys, because I know that I was a student and I was, literally wondering 99% of the time that why I am learning these things. Okay, once the why is clear in my mind, I can better, my attention is better, my grasping power will be better. So why should be very clear. Okay, why we are learning this? If your goal is only the certificate, it's the dumbest thing, right? So of course, why should be very clear to you. If I am going to learn today how the calculation matters to us, how to do efficiently the dose calculation, just imagine your position in the healthcare team. Okay, how can you contribute? Okay, at what extent you can contribute in the healthcare? That is very huge if you know this principle. That is, I think, enough the why. Okay, but still, I will show you in very first bullet point why exactly this calculation matters to us. What is the global burden we are having? What are the type of errors in the healthcare is happening because of just the minor things happens in the dose calculation. Errors happen in a dose calculation. Okay, I will show you some real cases as well to understand the sincerity behind this. Okay, so the human cost of errors, we will see SI units and conversations. Many of you might already be aware of it, but this is the foundational session. So I need to start with these SI units because, of course, this is the backbone. SI units are the backbone, and conversation, like once you need if from the one unit to another unit you need to convert, basic things should be clear to you. What to divide by 1,000 or multiply by 1,000 and all. So these simple things we are going to discuss. So those who are not having any idea about the dose calculation, this lecture will making sense to you. Okay, we will start from the zero. So anything to learn, from scratch is always fun. If you don't know anything, it will be very fun to understand, right? So, of course, second point we'll discuss SI units and conversation. Third, we'll discuss about decimal safety rules. Okay, small dots, big consequences. I will let you know what it is in upcoming slides. Fourth will be prescription interpretation. So understanding that what the doctor actually means by adding some abbreviations in it. Many of you might already be aware of these things, but this is the foundation. So we need to set the base. And verification best practices. I will let you know some golden rules how to verify every time. These are the mandatory things one person, one healthcare associated person should, practice, but they are not doing it. Okay, unfortunately. But you must be knowing it ideally what should be there to avoid any type of mishap. Okay, so verification, like because even smart people make mistakes many times. So system saves lives. So we need to understand how to do a verification. And everything is connected. Okay, from the very first point to fifth point, everything is connected here. Nothing is random. And these five bullet points will be our main agenda, main roadmap for the session today. I hope it is now clear to you that why we'll start with why and we'll move forward with step by step with the verification. Okay, so today your whole foundation will be clear and the whole tonic will be there in your mind to attend the sessions for next 7 days. Okay, so let's start with this. Let's start with the very first thing. Okay, the high stakes of medication errors. So, quantifying the annual impact for you to understand what is the ratio we are having. Right? So let's talk about reality here. This slide is showing you the reality. Not to scare you, these digits are not to scare you, but make you aware. Just a minute, I think someone is wanting the link. Okay, this is the first session, so that's why these issues are there. But okay, no problem. Okay, so let's talk about reality. I must say. Okay, so these digits are not because of any type of not intended to scare you, but make you more aware. So you need to understand this ratio, guys. Okay, see this 9K. That means 9,000 deaths per year, annual US deaths. Now, this is happening in the United States. I have not included any ratios, okay, from our region, but that the reason you will understand at the end of the session, don't worry. But this is what 9,000 deaths per year is happening in the United States and which are preventable. What do you mean by preventable? If you do certain changes in it, this range can be minimized. Okay, so these are some estimated annual mortality resulting which are directly from the medication errors in the United States. So you can consider it, these are the medication errors. So of course it is preventable if you have enough knowledge, right? Then you can see here $40 billion cost. This is the burden on the healthcare, guys. This is the annual economic cost, total healthcare expenditure which are associated to managing and rectifying these 9,000 preventable medication errors. How much big amount of money is involved in this thing. And the last orange color you can see 38% wrong dose errors. This is the most common type identified in the medication errors, guys. So 38% is a huge thing, right? So maybe 5% because of drug-drug interaction, 2% because of ADR, some other things, but 38% is a wrong. It is because of wrong dose. Just this slide is enough to understand why we need to learn those calculation in detail. Correct? So this is extremely important slide for making you more curious. Okay, I hope this slide is igniting, a sense in our brain that yes, this is the need in the healthcare, and we must understand we must understand the importance of learning those calculation in detail so that we can stand out in the team, or else we can actually, make an impact, make an impact. That's simple. If you are learning a pharmacy for 4 years or 6 years, and if you don't have any type of knowledge related to how to calculate a dose, depend on the patient, right? That is making no sense of having 6 years of education or 4 years of education. No sense it is, right? This is same like You are doing a engineering and you are doing a mechanical engineering and you don't know how to fix a bolt. Correct. This is same. This is same. So just make yourself aware that this is the reason behind why I need to learn this. Okay. So I hope now why is clear to you. Now this whole slide is telling us something very important, that most of the medication errors are not due to wrong drug, guys, but it is because of the wrong dose associated with it. And surprisingly, unfortunately, the deaths are also happening, mortality is also happening because of dosing errors, and no one aware of this thing. Okay, so this is where it becomes very important for us to understand. So the key teaching point here in this slide is dose calculation is not a minor skill. As I earlier told you in the introduction very clearly, 50% of the things you will get in this course, 50% is depend on your practice how to do it. You need to have note and pen with you every time you go in the ward, checking the prescription and applying whatever principles we are learning today. Correct? So, this is not a minor skill, guys. It is one of the strongest patient safety tools you will ever have. Okay. If you are writing in your CV, if you are writing in your internship practice or the curriculum vitae or the resume, that you know how to calculate a dose for a particular patient related doses calculation, it makes sense, right? It is a huge thing. So that's the reason. I hope why is clear to you by looking at these three colors. Now we are ready to move forward with the next slide. Again, why calculation error occurs. Now understand क्यों होता है ये? What is the reason behind it? Why calculation occurs? Error occurs. Okay, so we will explain one by one. See, because of heavy workload, because of night shifts, because of time pressure, because of poor storage, because of batching medicine, these all are the reason behind dosing errors, guys. But let me give you something, the idea of something which is not written here. There is also one more error which is not written here, but it is there and which is very big, and that is knowledge error. Okay, so despite of having heavy workload, night shift, time pressure, poor storage, batching medicine, and all, you need to have knowledge also, right? So what I have observed throughout my practice is these reasons are there. These reasons are there. Of course, it is there, but knowledge is also one of the reason behind the healthcare professional are not being able to calculate dose appropriately. Okay, so just imagine timing is also making very big impact. Like imagine calculating a dose at a 3 a.m. With alarms ringing and patients waiting, right? So these all things also happens in the hospital when they are doing a survey and all. These are also having a large percentage of making a dose calculation errors. So this is also the reason behind it, right? So some type of decimal misplacement, some kg versus there's lbs confusion, some overconfidence, skipping rechecks, verification nahi kar rahe hai. So these are also some miscellaneous reason behind generating, these are also the reason behind they are end up being this whole scenarios, and they are end up in what the calculation errors, right? So errors usually happen not because of people don't know, but because they assume sometimes, right? They assume. So systematic vulnerability is also there, like errors often stem from batching medications, skipping safety checks and all. And sometimes individual calculation pitfalls is also there, as I earlier told you, misplacing the decimal points or using some incorrect weight units frequently, okay, because of overconfidence. That is also the reason behind it. Apart from it, one of the reason is they are not aware of how to do it. That is knowledge error, right? So this is also one of the factor to contribute into this calculation error, and we will work on that scenario. Okay. Now this is also a very important slide. This slide, let me tell you about a real hospital incident to understand this why and the importance of the topic, because this is the foundation. You need to understand the why behind it, right? So see this is a real hospital incident. So patient ordered what one very important tablet, like For example, infliximab, right? So patient ordered infliximab, that is the arthritic drug. Pharmacy prepared some of the this etoposide, that is the chemotherapy. So due to batching and skipped label checks, result is very, inappropriate later. Patient experienced severe hair loss, some emotional and physical harm as well. So the dose calculation itself was correct, but the process here is failing. Okay, so calculation without verification is also incomplete. So this slide is to make you aware about verification is also as important as calculation. So, whatever learning we are going to see from tomorrow onwards, we'll dive into one each of the category from tomorrow onwards. Just make the habit of doing a verification at every step, because this is also happened. This is also a real case, guys, right? That the patient was ordered infliximab and pharmacy prepared some other things, right? So you need to verify also. You need to always correlate it with the clinical picture, clinically signs and symptoms and all, right? So this is one of the very important compounding error you can consider, and you need to check all the time the calculation with the clinical picture, whatever the patient is having. What is the chief complaint? What is the diagnosis? What the laboratory thing is suggesting? All together before going for the conclusion. Okay, and this is one of the biggest loopholes in the India right now, that we don't have any type of verification system, guys. Okay, because of crowd, because of large population, hospital is always crowded, pharmacy store is always crowded, we don't have enough time to verify. But this practice must be implicated. Okay, so you are the future, so of course I can tell you what are the ideal things should be there in our practice, so you can implement it, correct? So let's understand now the anatomy of the compounding failure, so that you can have the idea that yes, apart from the dose calculation error, these are also medication errors we need to take care while handling doses. Okay, so see this, visualizing this chart, okay, the sequence of events that leads from the routine order to some hazardous dispensing errors as well. So very first here is a batching order. To save time, this batching orders happens, but it increases your mental load. Okay, so multiple high risk medications are there which are grouped together to save the time and to save the amenities as well, but it increases your cognitive load, right? Then second is the label misidentification, like trusting some vial shape instead of reading the names only, right? So reliance on the further vial shape or similar packaging rather than reading specific drug name, that is also one of the compounding failure you can consider. And next is the checklist omission. So skipping, double checks during the rush hours. If there is so much rush out there, you are skipping the double checks. And that is what exactly happens, right? So errors don't fall from the sky. Correct. They are built step by step. Every step there is a chance of error. So yes, which step could you prevented, these things? Of course, at every step you need to have the verification here. Okay, and I have a very good example to understand this anatomy, that is this insulin versus influenza vaccine. Now, this is one of the biggest case in the real practice, which is published as well, and real case scenario. Okay, so this happened during the routine vaccination, guys. ये कब हुआ था? This has happened during routine vaccination, where insulin and flu vaccine vials looked very similar. Okay, the insulin vial and the flu vaccine vial look very similar. They store together, and nurse, rely on the familiarity of the vial. Okay, they are in a rush, so they didn't see the drug name and all. And the result is, of course, if the patient is wanting a flu virus, the flu or a virus type virus के लिए, if they want the vaccine, and they end up taking insulin, right? Because of that storage issue together. So result was very clear: hypoglycemia and immediate hospitalization. You can see here resulted in very low blood sugar and multiple hospitalization. So the key line here to understand is familiarity is very comfortable, but it is very dangerous in healthcare. So we must aware of these things too while handling doses, right? So this is very important. Now see this slide. This is a very important thing, the parallel of the familiarity. Our brain, loves shortcuts, I can say. Our brain is very different type of makeup is there, and our brain loves shortcuts always, but in medicine shortcuts always harms us. Okay, so please fit into your mind, whenever you are calculating a dose or checking the prescription, verification rechecks is extremely important. Okay, so shortcuts is very dangerous in our case. So you can just have the idea. We have the nurse, accidentally gave insulin instead of the flu vaccine, influenza vaccine, due to reliance on the familiar vial shapes without checking the label. And this I can also give you the reference also. This is published in Institute of Medicine case study. Safety report finding category. In the safety report finding category, they have published this article, which is a real case. And I don't know how much amount, how in a big amount these cases are happening throughout the world as well. Okay, so this is the reality. So whenever you are handling a dose calculation, you must check and recheck everything. See, this is also one of the example to understand the pediatric amoxicillin overdose. I think our next module is on this only. So of course you need to make these things very clear in your mind. So children are not, small adults, guys. We are treating children as in small adults in the hospital. Many time when I have I have experience in the pediatric ward, and many time I have observed this thing, like physicians are also calculating a pediatric doses as per they are they are considering them small adults, like half of the tablet, 1.2 1.2 portion of the tablet and all. This is very unreal, right? So this is very important. See this case. Infant was prescribed amoxicillin here. A case study was there in the weight based calculation error, where the four-fold overdose was administered to an infant 9-month old, that was prescribed a dose 4 times higher than intended. Because of the calculation used pounds instead of kilograms, guys. So that is the importance. Whenever we are going to discuss about pediatric dose calculation, I will let you know what is pound, what is kg, how to calculate it. The prescription is having pound, how to calculate it differently. Okay, how, if it is having kg, how to calculate it differently. So this is very dangerous situation. Okay, just because of pounds were written instead of kg, four times, like 4 times higher than intended dose was given to a 9-month old, demonstrating the danger of unit confusion, guys. So infant was prescribed here the amoxicillin, not mentioned, but I will let you know. So yes, amoxicillin was prescribed. Weight was used in pound, calculation assumed in kilograms, and result was very simple: four-fold overdose. In pediatrics, weight-based dosing leaves zero margin for unit errors, guys. We cannot have this. Okay, and this is also one of the published report in the safety category. This is the importance of learning dose. Are we here to save people or to kill people? I don't know. Right? So even if you have interest in the dose calculation, even if you don't have interest in dose calculation, this is going to be your sole role and responsibility as a healthcare professional to understand how to calculate a dose. Correct? This is where our role are fitted. Okay, this is what the expectation of recruiters in the hospital setting, that you can eliminate this type of errors. Okay, so this is the importance. Pediatric amoxicillin overdose. Now let's come to, I hope the why is clear to you. Very first roadmap is clear to you. Second was SI units and conversations. Many of you might already be aware of this thing. If you are not, please remember this table, because it will going to be helpful to you in upcoming 7 to 8 days. So this slide is where most of the fear begins. Many of you might be aware of these things. I am again repeating, but still making some type of mistakes, very silly mistakes, but big impact, right? So this slide is where most fear begins as well as ends. If you once understood this table, your fear will end. So understand this units very simply. We have kilogram that can be abbreviations are written on the middle of the column, so you can just understand. Kilogram is there, gram is there, G, right? Milligram is there, which is mg, and microgram is also there, sometimes written as mcg or this micrograms, sign. So these are the units, and rule is very simple, guys. Rule is very simple. On each step, kilogram, gram, milligram, microgram, in each step, either you can multiply it by 1,000 or divide by 1,000. That is the only rule here. Okay, very simple. This is SI means standardized. Okay, standardized factors for converting this pharmaceutical mass measurements within the international system of units. Okay, so SI units is a international system of units you need to understand, and each of the step, whether you need to have kilogram to gram, gram to milligram, milligram to microgram, or vice versa, you either need to multiply by 1,000s or divide by 1,000. That is the golden rule. For this slide you need to remember. And I have also included equivalent in gram, that another column here, just for your understanding, because everything majorly 90% of the time it is equivalent to grams, which is written. So you need to understand that 1 kg is equal to 1,000 grams. Okay, so 1 gram. Okay, so that you need to understand. 1 kg is equal to 1,000 grams. And 1 mg is equal to 0.001 gram. And 1 microgram will be, you can see here, 0.000001 gram. Either you need to multiply by 1,000 or divide by 1,000. Okay, so how can you remember this? There is a memory trick for you. Just write down in your notebook. If you are going downwards means kilogram to gram to milligram to microgram, you need to multiply. Simple. Okay, you need to multiply. And if you are going up forward, you need to divide. You need to divide. So write these two sentences in your notebooks. That is the golden rule for this whole thing you need to remember. Just have the picture in your mind of kg, g, mg, and mcg. This four in sequence you need to remember. Kg, g, mg, and mcg. And remember that going down is multiply and going up is divide for this. Okay. And you need to do it in practice. I will let you know by hands on. Whatever after tomorrow we will going to see. Don't worry if you have still the confusion, it will be clear to you in the real practice. But for now, just remember this. Okay, and never ever calculate without writing units, guys. You need to mention everywhere the units. Okay, imagine 1,000 is being written, but no unit is there, whether it is gram, kilogram, mg, or mcg. What happens next, you know. Okay, so try to practice, write always the units. This is what the SI units is. And this is another slide to understand the units. Volume units. Okay, volume units in the pharmacy you need to understand. So far, we talked about mass. Okay, this slide was talking about mass. Okay, the pharmaceutical mass measurements. Now let's talk about volume. So, which is equally important in the pharmacy, you know that, right? So, you need to understand liter here, that is used for the large volumes like IV fluids over here, right? NS, RL. For that, liter is the unit which is used. And for the bulk oral solutions, also the liter is standard unit. Okay, you need to remember. And we have another is a milliliter, ml, that is used for what? For smaller one like syrups, injection, pediatric doses. For small volume injections, milliliter is being used. And conversion for this liter to milliliter, milliliter to liter, that is very simple. 1 liter is equal to 1,000 milliliters. That is very simple to imagine, or very simple to remember as well. Milli is a small unit. So of course, 1 liter consisting of 1,000 milliliters. Okay, no explanation is required here. And if key rule is here is very simple. 1 liter is always equal to 1,000. That is the simple line to calculate and to convert liter into milliliter, milliliter to liter. I can give you some clinical example to correlate. Like for an example, IV saline. Okay, IV saline, 1 liter over 8 hours is prescribed, and paracetamol syrup is 5 ml per dose. That is how it is being written. Okay, so if it is NSRL, large volume, okay, oral solution, it is always in a liter per hourly. Okay, and these paracetamol like syrups, some small volume injection, these are considered as a milliliter per dose. Okay, so don't worry. Next slides it will be clear to you. Many things are going to we are going to discuss, but for now just understand volume of units. Okay, so confusing volume is very dangerous, guys. This is not as simple. Okay, especially in the IV therapy, it is very confusing. I will let you know some of the very good examples also, so that it will be making sense to you that how exactly this volume unit is making us confused. See this. Now, the next slide you need to understand after SI units and this mass units and volume units, step by step, this mass conversation, which is very important. Now, this slide is your safety checklist I can consider. Okay. Safety checklist for conversation. So, if you follow these steps, no, you will almost never go wrong, guys. So, this is the importance of this slide. Okay. Walk through this each of the step. See very first. Identify the source unit. What unit is written in the prescription? Locate the prescribed unit, whether it is an mg or whatever available and the available unit, whatever it is. First, focus on the unit. Very simple point. Second, identify the required unit. Determine the factor. Okay, use the factor of each step between whatever the gram, milligram, whatever the microgram it is being written. Apply your math, like down the scale, multiply by 1000, up the scale, divide by 1000. That is what your apply. Math is there for mass conversation. Multiply by 1000 to move to smaller units, divide by 1000 for the larger units. So that is, if you want to remember in this sense, like move to smaller units and larger units. That is also the one way to remember it. Another way is down the scale and up the scale. I always remember the down the scale and up the scale. Okay. So in this slide, you can just remember that down the scale, multiply by 1000. And if up the scale, divide by 1000. This is the golden rule. So this is the another third orange step, that is applying the math here. And the fourth is verifying the strength. So always ask, does this dose make clinical sense now to the patient? Okay, because this is extremely important. Whatever the students are doing, no, they are doing very first three steps, 1, 2, 3, and done. They are not verifying it, that whether it is exactly it is suitable for the patient specific things or no. Because guideline told us till the third point, guys. Fourth is our skill. Okay, sometime your formula is suggesting you to prescribe some specific dose to the patient, but it is not required, or maybe it is giving you a more toxicity profile at the end. So in that scenario, fourth step is very important. So always ask, does this dose is making sense to this particular patient for which I am calculating? Okay, so maths give you number, but clinical thinking tells you that it is safe or no. Okay, and many people are failing at a fourth number, guys. And I want you to learn that also in a dose calculation, because it all goes simultaneously. Okay, so this is a step by step mass conversion. Identify the unit first, determine the factor. Determine the factor, that means identify what is required unit. Okay, so if it is written in mg but you require in mcg, okay, pediatric, for an example, imagine you are handling a pediatric prescription, and if it is written in the mg but you need for your patient in microgram like mcg, so you will apply math here. Okay, I am going downwards, so I need to multiply by 1000, right? And you will multiply by 1000, you will be having your the exact dose with you. And fourth will be, you will verify whether my patient is having any benefit for for this dose or no. Okay, so this is how exactly, if you are handling in some older, like elderly patient, older adult cases, if it is written in mg but you want the dose in the kg. So what we will have next? Up the scale, right? So this is how, as per your requirement, as per your calculation is suggesting, as per your formula is suggesting, you can do this 1, 2, 3, 4 step by step mass conversion. You will never go wrong with these things. Correct? But you need to understand these four steps. Now, let me tell you the danger of this thousand folds, thousand fold error, guys. So, we will visualize now how a simple unit, transposition between milligrams and micrograms results in the lethal toxicity, fatal toxicity. So, this is one of the most dangerous mistake I can consider in the healthcare, guys. Dangerous mistake, of course, right? Say this, 100 mcg, okay, 100 prescribed mcg, it is not as equal to 100 mg, right? Remember the table, we have kg, then we have g, then we have mg, and then we have mcg, right? Remember the table, we have kg, g, mg, and mcg. So if 100 prescribed mcg, 100 mcg लिखा हुआ है, if it is mentioned 100 mcg, it is not equal to 100 mg, right? C is making sense here. Difference is 1000 times, right? So standard microgram dose for the potent medications like fentanyl and all that is, there is a very big impact. For an example, fentanyl, digoxin as well, right? Digoxin as well. This very big issue will be associated with this kind of drugs, right? Fentanyl, digoxin, levothyroxine is also one of the example here. How can we forget that? So if it is mistaken as an mg, what happens next? So the dose, if mcg is misread as mg, that was result in massive toxicity because 1000-fold will be there. 1000 overdose factor. Lethal, multiplier, created by transposing these two common SI mass units, guys. And 1000-fold error is usually not correctable. We cannot correct it further. So there is no time to fix it after once the administration is done. So always write units fully and read them twice. Okay? If it is not matched with your clinical picture, always ask. Okay? There is a big ratio of this error, guys, in real scenarios. So this is a danger of 1000-fold errors. MCG and MG. You need to have lots of attention to details while reading the prescriptions. Okay? We have strict zero placement rule, guys, in our system. You need to be aware of this thing. This slide saves lives, I can consider. Okay, this slide having a zero placement rule in front of you, this can save lives, literally. Okay, so this is a leading zero rule. We have here some mandatory protocols for leading and trailing zeros to prevent some misinterpretation of dosage strengths. Okay, so what you need to do, always lead and never trail here. Okay, that is what the strict zero placement rule we are having. So what do we mean by this? Leading zero rule means you need to write it 0.5 mg instead of 0.5 mg. Okay, so always lead is suggesting this. Use a leading zero. What leading zero means? A first digit which can lead the sentence, lead the dose. Okay, leading zero. Zero placement. Okay, zero for the values less than 1. Whatever in point values, like whatever values we are having in points. For an example, 0.5 mg, 0.2 mg, 0.1 mg. You always write 0.5 mg instead of displacing 0 and only write to 0.5, because it can read as 5 sometimes. Point is disappeared. Okay, and again, there is a huge difference in 0.5 mg and 5 mg, right? So this is the rule. This is the golden rule. You must be aware. Missing 0, that can turn half into the 5. And that is a big issue. And next is never trail. So trailing 0 rule. Trailing 0 means you need to write always 1 mg, whatever greater than 1 range if you are having, you need to always write as a 1 mg and not 1.0 mg, because it can misread as a 10. Correct? So two things are there. Always leading and never trail. Okay? So 0 should be always in lead. Means first. Right? Whatever values we are having less than 1, we need to start with 0 point. and whatever values more than 1, we don't need to end with the 0 there, right? So for example, 1 mg dose is there, we need to write 1 mg, not 1.0 mg. So it can prevent 1.0 being read as 10. I hope it is clear to you. So this is very important. So I am asking you here whether it is clear to you or no. May I have some reactions if it is making sense to you? Okay. If you have any queries, doubts in between, feel free to drop the message in the chat box. Okay. So please remember, many of you might be already aware of these things, but if you are not, this is one of the important thing. Whenever you will be going to have the interviews as a clinical pharmacist and all, they will ask you these things, right? So what are the strict zero placement rules should be there? How to read prescription correctly? What type of mistakes should we avoid, right? So we have this zero placement rule for the zero specifically, where to place it and where to not, right? So leading zero rule we have, and we have never trail rule with the zero. Okay, so trailing zero can turn into 10. Okay, powerful sentence. You need to remember this sentence. Leading zeros saves lives, while trailing zeros takes lives. Right? So this is a very powerful sentence, right? If you are mentioning all leading position zeros, that can save lives. Okay. But if you are trailing zeros, that can take life because it will be over, right? Over toxicity will be there. Large dose will be there. So less than 1 doses, of course, we need to put the zero. And if there is more than 1 mg doses, we don't need to put. Ultimately, we are avoiding point, guys. Okay, the point is big issue, creating a big issue. Okay, so we need to try to avoid it, right? So this is very important slide. Strict zero placement rule you need to aware. Now see this slide. Let's see how one tiny dot that can cause a massive error. This is also a published scenario, safety error scenario, right? See, doctor wrote the zero point 0.5 mg rather than zero point 0.5, and pharmacists read this zero point 0.5 as a 5 mg. Result was tenfold overdose of this Haldol, right? Haldol decimal misinterpretation, a real world example in front of you of how this omitting leading zero that can lead to a massive tenfold dosing error. The order was zero point 0.5 mg, and a prescription written without a leading zero was sent to the pharmacy. The result was, of course, the pharmacy overlooked the decimal, dispensing what? 10 times higher the as compared to intended dose of Haldol. So no one intended harm. So the error was purely a format related here. Format related, right? So clarity is a patient safety, and if you are in a field of healthcare, you must be aware that how exactly how ideally things should look like. Okay, so this is the biggest scenarios we are having in the history. The situation is life threatening, right? It is a life threatening situation. Hospitalization, complete hospitalization will be there. And there is a risk of, it is a case of life and death, right? So this is very important. See, this is also one of our example to understand Coumadin trailing zero error. We have this error as in leading zero, and for trailing this, analyzing how a redundant decimal point transformed further to a 1 mg dose into a hazardous 10 mg dose of Coumadin. The order was 1.0 mg. How to write it? 1 mg, simple, right? So the prescription included a trailing zero, which is not as per our rule, creating unnecessary risk here. Result, pharmacy read it as in 10 mg. The decimal point was off-scored, leading to an anticoagulant overdose. Of course, this is anticoagulant, and bleeding risk, internal bleeding risk will be there. Potentially fatal situation this is. This high risk drugs and uske saath, and plus if there is a decimal error, guys, trust me, this is a disaster. Okay, and these are some of the published articles, recent real world examples I am putting in front of you. I will ping you a reference link also if you want to read these reports in detail. Okay, so these are published in a very reliable resources, right? That on the safety profile. how much big things are happening in the world just because of point, and just because the physician, clinicians, and pharmacists are not aware of what should be, how exactly ideally things should look like. Okay. See this. This is another important thing. Not every calculation gives, a perfect number, but rounding is very important. Now, this is a safe rounding algorithm. Okay. So I am again repeating, not every calculation gives you a perfect number, but rounding, if you are practicing this, this can, this must be done very safely. Okay. So in this algorithm, what you need to understand is you need to identify for the first thing that you need to identify a precision here, like syringe markings or tablet availability, right? So determine the required decimal place based on the measurement device. Second is applying your 4 by 5 rule. Second step, which is down below, 4.4 by 5 rule. So if you have 4 or less, you will round down. Okay, you will round it. And if you are having a 5 or more in this, availability list, you will round up. So round down and round up. This is also a rule. This algorithm, safe rounding, right? This is also one of the practice to avoid some type of misconceptions, I can say. And high alert checks. So for insulin and similar drugs, rounding may not be acceptable in this cases. High alert checks. So in that scenario, you need to practice some another thing. But yes, some miscellaneous tablets, syringe, of course, this rounding practice help us. 4 by 5 rule is there. If the digit to the to the right is 4 or less, you will round down. And if 5 or more, you will round up. I will let you know how to do it. Don't worry. Okay. So this type of practice are happening in the world, but I didn't see in any type of my current practice that people are doing it. But yes, we can implement it by ourselves, right? So to avoid any type of errors. I will let you know how to do it very efficiently in our upcoming sessions. We will practice each of these things in detail. Okay, so don't worry. These are some of the very basic things in front of you. See this, high alert medication safety we need to understand. Some drugs, some drugs forgive mistakes, I can say. Okay, some drugs do not. So some high drugs are there, like high alert drugs are there. For example, we have insulin, we have anticoagulants, we have narcotics as well, right? So you need to understand that how neurotherapeutic index drug behaves. Okay, I hope you have idea about neurotherapeutic index. Every drug has this minimum, effective concentration, okay, and maximum safe concentration. So minimum effective concentration will be required to have the therapeutic effect, and maximum safe concentration before, above which it will lead to toxicity. The range between this minimum effective and maximum safe, that is what the therapeutic index is. But we have some of the drugs like anticoagulants, warfarin, heparin, we have insulin, we have narcotics like phenytoin and all, right? We have some narcotics specifically, opioids, morphine. This type of agents have a very narrow therapeutic index. When I say narrow therapeutic index, that means the range of minimum effective concentration and maximum safe is very low. Now imagine if I am not maintaining a dose of a particular drug in this particular range, what will happen next? Either no therapy or toxicity. Two possibilities are there. Okay. So for that reason, those drugs are having narrow therapeutic index, very sensitive drugs they are, right? So small, even a small error in this particular dose calculation of these high alert drugs, that can lead to severe harm. So whether it is associated with phenytoin dose calculation, warfarin dose calculation, insulin calculation, this is where exactly our skill is required, not to calculate a PCM dose, right? Of course, it is dangerous, nephrotoxic agent, but it is not giving you as toxicity as these drugs are giving, right? There is a difference between narrow therapeutic index drugs, okay, and broad spectrum. So yes, of course, you need to understand these things. High alert medication safety, specific consideration for the drugs with narrow therapeutic index, where the calculation errors are most likely to be fatal. So we have insulin, anticoagulants, narcotics. These are high alert. Okay, and we have some of the no error zone as well for this. Okay, so decimal errors in these drugs often lead to irreversible harm or the death directly. You can imagine a warfarin here. Warfarin is associated with hematuria condition, right? Hematuria means blood which is coming in the urine. Why? Because it is anticoagulant, blood thinner, right? So, of course, it can lead to internal bleeding risk. And if you are not doing a dose optimization while handling warfarin and heparin things, it can lead to internal damage and directly the organ failure and death, right? So, this is the reason behind we need to pay more attention towards high alert medications. Okay, so neurotherapeutic. Now, this is a mastering frequency abbreviations slide just to understand how to read the prescription correctly. Obviously, if you are in a healthcare, you must be aware of these things. So, doctor often write, fast abbreviations to save the time, but only if we understand them correctly. So, yes, BID, that is twice daily. Okay, in the latent term also you need to understand these things, because sometimes they practice this also. When you working in a very big hospital, sometimes they write is this BIC in die, that is what the twice a day means. Then we have TID, that is three times daily. We have QID, that is four times daily, and we have PRN, that is proranata, that is as needed. Okay, so this is also you need to understand. Wrong frequency means wrong drug, guys, wrong drug exposure. So, TID mistaken as BID. That is what happened next. If the three times daily, if the person is need to take the drug and your reading is as a twice a daily, what happens next? Of course, under dosing. You can just imagine the opposite scenario. If the BID mistaken as QID, what happens? Toxicity, right? So this is very important to read the prescription correctly. Okay. So this is a simple thing to understand. We have some common route abbreviations as well. So route determines how fast and how strong the drug effect will be. Okay, or how fast or how strong the drug will act in the future. So you need to understand that PO, that means by mouth. The IV, that is intravenous, that means into the vein, and which is the fastest. Okay, intramuscular is IM, into the muscles, and we have subcutaneous, that is under the skin. I hope many of you might already be aware of this POIV, IM, and subcutaneous route. Of course, IV morphine, if you can imagine IV, intravenous morphine, that is not equal to per oral morphine dose. Of course, intravenous will be fastest, right? And the wastage is also very less if it is IV, right? So fastest mechanism, and we have lots of PKPD mechanisms behind these routes. Appropriately, we can, accordingly we can choose appropriate route. But we need to understand what is written in the prescription. Okay, same dose, but still different effect will be there based on the route. Correct? So same drug, same dose, different route will be there, different outcome will be there. Route is also as important as the dose. Correct? So also based on route, we need to calculate the doses, guys. If IV is there, requirement is intravenous, we need to calculate dose accordingly. If the requirement is intramuscular, we need to calculate dose accordingly. That's the reason I have put this slide in this module, so that you can be aware of that route is also playing an important role while handling a dose calculation. Okay, so dose calculation is not something like one chart I can summarize. It is a branches like a tree. Okay, if this is the thing, there more branches will be there. If this is the scenario, more branches will be there. So imagine a dose calculation as a big tree. Correct? We have multiple factors in this under this tree to calculate and to understand. Accordingly, our need, whatever our need is there, accordingly we can adjust. Okay, so this is the common routes. And also you need to understand, do not use, the do not use list. So now this slide is extremely important again, because these abbreviations are officially banned. Okay, these abbreviations, I am again repeating, officially banned in many hospitals. You need to understand why. Why these abbreviations are dangerous? Because they save time while writing, but they cost the clarity. Okay, and clarity is non-negotiable in the healthcare, guys. We cannot compromise on clarity. For an example, you or the IU, which is, this can look like zero, this can look like four as well. Okay, especially in the handwritten, orders. You might be having this experience also while handling a prescription. These are some critical abbreviations that are banned by safety institutes due to their high frequency of misinterpretation. So never ever use unit, IU, international unit. Always spell out units, to prevent any type of misreading as 0 or 4. Many times, I think I can say insulin, calculation is happening in the international units and units. But you need to understand that yes, this is confusing, and if it is banned, we need to stop it. Correct? This is banned because of some safety related reports and all. So, what is the correct way? What is the correct way? Always write you need some. Okay, always write UNITS fully. Okay, you are not supposed to write QD or QOD. You need to write it daily. Okay, QD, QOD, no. You need to write DAILY daily or every other day, whatever you need to write. Okay, so for in past, what happens? QD means daily and QOD means every other day. But now this is banned because of some misread scenarios, and it is huge. The banned Safety Institute banned this. You need to write daily and you need to write every other day fully. Okay, or often it is, this QOD is always misread as a QID, and which is 4 times daily. Okay, that's the reason behind the ban. I hope you now it is clear to you. See this this 4 times, this 4x daily is mixed up with the QID. Okay, so of course every other day is you need to write, daily you need to write, or whatever you want to elaborate, you need to write it fully. Okay, so this is the reason behind the ban of QOD and this QD. Now just imagine every other day means one day they need to skip, right? And instead of that, they are reading it as a QID. QID means here it is written. QID means you can see the meaning 4 times a day. What happens next? Okay, so because of these misread things, they changed and they banned it, and fully practice is being implemented. So write daily or every other days, you need to remember. So if an abbreviation can be misunderstood, it will be again, the whole thing will be considered toward the mishap. Okay, so you need to remember this. Now, interpreting timings like AC versus PC, that is also you need to remember. We are coming up towards the end of this session. That's the reason I have put this plate in front of you, because it is a dinner time. So of course, yes, but you need to understand interpreting this timings. Okay, so timing is not just about the convenience, guys. It is, it is affecting how the drug is being absorbed. Okay, so AC means what? Before meals. This is the exact reason behind the meal picture. Okay, so AC means before and PC means after meals. You need to be aware of these two terminologies. So, critical meal related instructions that determine the absorption and efficacy of oral medication timings, abbreviations like AC, that is before meals, and PC, that is after meals, these are essential for medications whose absorption is affected by the food. And on every, almost every medicine is affected by food, such as certain antibiotics or diabetic drugs and all. Right. We have some clinical example, like some antibiotics better on an empty stomach, while diabetes drugs coordinated with the meals, right? Some omega-3, vitamin D, these things are also coordinated well with the food, okay, with the fat. So these are the very important things you need to take care of if the patient is taking antacid, of course, before meal. Okay. So correct drug, correct dose, but wrong timing, again, it will reduce your overall effectiveness. So if you are calculating dose, this timing again will making sense to you. This is also one of the factors, one of the branches of the dose calculation. By the end of, I think, fifth module, you will get to know why. Okay, you will connect the dots of this foundation session to every 7 sessions, and it will making sense to you one by one. Why we are discussing timing, frequency, and everything all together? Because we are here for the dose, right? Why we are discussing this? But as I told you that dose calculation is a tree, okay, and we need to calculate accordingly. Every situation will be different. Okay, see these components of a valid prescription. So whenever you see a prescription, your brain should automatically scan, for these components. It should be actually. Very first, drugs name and strength. For an example, if clear name, you must be focused on, and metric strength. So you are saying amoxicillin 500 this milligram mg. Okay, so this is avoiding a brand only ambiguity. You need to understand the name and the strength of the drug. Second, dose and route. How much? and how is it given. Okay, quantity to take and how to take it, like one tablet PO, correct? Then patient identifiers, like full name, sorry, the third one is the frequency. So how often the medication is administered? Is it a BID, TID, QID? What is it? What it is? And then patient identifiers, like what is the full name of the patient, date of birth because of the age calculation. Okay, based on that, the doses will be there to calculate full name and date of birth to ensure the correct patient. So this should be scanned by your eyes whenever you are seeing a prescription, guys. Even if one of this, is missing, you need to stop and clarify again, because these four things are very much required to calculate your dose. Components of a valid prescription. These things are available to you, then and only you can calculate a dose. You can start your calculation by verifying these four pillars in the prescription. Then you can consider it is a valid prescription. Okay, don't rush in the dose calculation. With minimum information, you cannot calculate a dose. Okay, if you don't know what is the age of the patient and you only know the tablet name and the frequency, how can you calculate appropriate dose for suitable for the patient? No, not possible. If you don't know the frequency, still you cannot calculate. If you don't know the dose, if you don't know the route, you cannot calculate. Okay, of course, name and strength is ultimate. So remember always, whenever you need to start a dose calculation, this thing should be there with you. Okay, the four pillars. And verification, best practice, what you can do. So even the best pharmacist makes mistakes, guys, and that's why system exists. This system exists. You need to understand this three things in detail. Primary calculation. This is implementing some safe flavors, right? Primary calculation using some dimensional analysis or ratio proportion. I will let you know how to do a primary calculation. We are now slowly going towards end of the session, and also what is coming next. Okay, so primary calculation using some dimensional analysis, I will let you know tomorrow what is this. And also the ratio proportion. Okay, tomorrow we are going to deep dive into this primary calculation. Second, you need to do an independent check. Like second person calculates without saying your answer. Okay, so that is an independent check. Second license provider verifies the maths without saying what is your final result. That is very important, and this is very important practice you can do with your friends while handling prescriptions in the hospital. Okay, so you calculate the dose, check them to independently calculate the dose. Okay, and clinical sanity check, like does the dose fit to the particular patient, because formula to batayega, theek hai, formula is there just to show you the numbers, but is it important for your patient? Is it beneficial for your patient? As per the patient's own physiology, some other factors, some comorbid condition, what is renal status, what is hepat status, whether it is giving benefits to him or her. That is what the clinical sanity check. Okay, does this dose fit to the patient's age, patient's weight, renal hepatic function, right? So verification. Verification is not about the mistrust. Please understand, it is about the patient's protection, and we are all here for the patient-related care. So we cannot compromise with clinical sanity check. Okay. So please remember this verification step. These three are the verification practices, and we have some patient-specific factors also. For an example, two patients can receive the same drug but should not receive the same dose, guys. Please remember this thing, okay? Two patients can receive the same drug but should not receive the same dose. You need to understand, pediatric patient uses what? Uses mg per kg. Always converts into, this you need to convert it into the lbs to kg first. I will let you know when we are going to discuss about pediatric, how to calculate lbs to kg. Okay, so you will have sense. But yes, of course, same drug, two different people, two different doses, of course. Okay, so in pediatric, extreme precision is required. You will use mg by kg only after converting the lbs to kg. Simple rule it is, I will let you know, don't worry. And when the organ function related thing is there, for an example, renal impairment, you will reduce clearance. You will, if you are not doing it, risk of accumulation will be there. Right? So renal and hepatic impairment requires dose calculation to prevent drug accumulation and Guys, we have formulas for it. Okay, good formulas actually for the renal as well, for the hepat as well. We just need to fill the values in it and it will show the picture. But it, again, I'm saying it is just giving you the numbers. You need to correlate it with clinically whether it is suitable for your patient or no. Okay, so ignoring patient specific factor turns into a correct, calculation. So calculation into unsafe things, right? Unsafe dose. So that is the reason you need to be very specific, patient specific things. Okay, and the last line of defense, this is very important. So in real life software can fail, guys. Software can fail, but charts also can be wrong sometimes. Charts can be also wrong, but your thinking must not fail. Okay, so you need to understand this whole triad. One, two, three. It is a triad. Very first is a this the critical thinking. So questioning orders that don't make clinical sense to you. Always ask question that whether it is important or no. Foundational math, right? Always verify, rigorous double checks and secondary methods you need to incorporate. And the third thing is a foundational math. Flawless SI units and decimal application you need to maintain. A pharmacist is not just a dispenser. Pharmacist is a safety barrier which goes up to this triad system to verify everything altogether to save lives. Okay, so you need to be aware of this thing, the last line of defense, and your role in the patient safety. So, as we end the session today, I want you to remember a very simple thing, guys. See, precision, it is not an option. Okay, precision is not an option, which is written in this slide. You can just read it. Okay, it is a professional obligation. Okay, so you need to take some points from this session, that leading zero saves lives. Remember this thing. Trailing zeros takes lives, of course. Okay, double checking every calculation is very important. Clarity, clarity after every doubt is very important. So you need to understand that, what, one correct calculation by you that can silently save life, and one bad calculation that is that is taking lives, correct? So no one may ever know, but what your influence is on the prescription and while handling patients, this is very big, correct? So that is the true meaning of professionalism, and this is what the meaning of learning dose calculation. I hope this session is helping you towards only I hope my objective is satisfied, that you know now that how exactly we are moving forward. Okay, so yes, just give me a 1 minute and I will be back to solve your queries. If you have any, please feel free to drop into the chat box. Today's session was only foundation, so yeah, that is this is a recorded session, so don't worry about attendance. Our team will monitor it. Okay, so you guys are asking for PPT, but see, we have simple rule in the climate research, and that is you will be having a direct link of recording of this whole session. So I cannot share the whole PPT with you, but you can have this link of seeing these recordings alongside, right? So that recording will be there in the group. See, guys, today we didn't learn any formulas, okay, but we learned how to think like a clinician or like a healthcare professionals. We learn how to think safely. Okay, so I hope now the base is clear, the foundation is clear. So from next session, we'll start applying this, applying this thinking actually step by step, and we'll learn how to calculate the dose correctly. And it will be going to super fun of learning this. Invalid prescription, I think there should be weight also, because sometimes only age is not sufficient. Yes, valid prescription do have these things also. Of course, the weight is, must be there. In some cases you will be requiring, in some formulas you will require height as well. Okay, so we will see lots of things that will be there, but these are some of the very primary thing you need to identify first. Okay, very primary, like if you are not having this, you cannot move forward. Okay. Okay, I can say some dose related query. I was expecting. Don't rush, guys. Okay, everything will be there. I will tell you how to convert every decimal. Okay, don't worry. For now, today we were only having the basic things, the foundation. Okay, so conversion related doubts we will solve it whenever we are going to discuss in detail in the theory. You can see our brochure. We have everything in detail. I know your curiosity and I can feel also, but have some patience. We'll see our tomorrow we'll discuss about weight based and body surface area related dosing, how to do it. Okay. Next lecture on Wednesday, we will be having a dosage forms and strength based calculation. We'll be having IV calculation, infusion rates as well. We will have renal hepatic as well. Some special population like pediatric, pregnant women, high risk dose calculation we'll see. And lastly, on the seventh day, we'll have a clinical case marathon as well. Okay, so everything will be clear to you. Don't worry. So conversation related doubts, please hold on. Okay, have some patience. Understand the basic things. Yes, someone is raising hand. Do you want access for a microphone? Just let me know. Okay, I think that was by mistake. Yes, you will be having classes daily. This is a week long course. You will be having class till next Monday. Okay, 7 lectures will be there total. Sunday we will be having a break, so Monday your last session will be there. Any more doubts? Okay, so no doubt is there, but still I want I just want you to remember that I am just a message away. If you are seeing this recording of this session later as well, if you feel some doubts later, feel free to drop message in the WhatsApp group. You can personally also message me. I'm just, you can type a message to me. I will solve your queries, whatever you are having. Okay, I'm just a message away as a gentle reminder. Okay. Okay, if no queries are there, we can wind up for today. See you guys tomorrow. Link will be there in the group. Okay. Thank you so much for joining today. Thank you. Good night.